Good evening, everyone, and welcome to our AGM for 2022, a year in which the organisation stood back, reviewed and restated our core purpose through the launch of our new strategic plan, which will take us through to 2026. The plan was approved by the board in April of 2022 and launched in September at our annual conference. It is the culmination of an intensive process of consultation with members, service users, volunteers, staff and representatives from the medical and scientific community. The work began in 2021 during the COVID-19 pandemic, a time of great challenge, but also a period when creativity was in abundance, as we all came to terms with adapting to the ever-changing environment. These factors helped to shape our strategy, as well as the commitment and passion for the cause of epilepsy, shown by every person from all parts of the epilepsy family who took part in the process. The plan provides direction for sustainable development in responding to the growing needs of our community and to deliver services that positively impact our service users. However, the board recognises that the plan is ambitious and that there are several challenges on the road to implementation, primarily investing in the plan with the appropriate level of resources needed. As well as restating our mission statement and defining a core set of values that our organisation holds dear, the plan also establishes 6 strategic aims, which I will go through in my report this evening to update you on the progress in 2022. If you'd like to know more about the plan, please do visit our website and download a copy. Our first strategic aim was empowering people with epilepsy through support and education. Support and education services for people with epilepsy, their families and carers, and the wider community are central to our work. Services include one-to-one support, educational programs, individual and group-based self-management programs, community and hospital-based outreach services, support groups, events and seminars, a range of resources and publications, and personal advocacy support. This service is delivered by our 11 community resource officers based across the country. 2022 saw continued demand for our services with a total of 19,917 contacts made with our services team. With COVID-19 fading further into the background of 2022, it was good to see in-person elements of our work returning, while continuing to provide services online to remain as accessible as possible. The importance of the in-person elements of our work was really highlighted through the returning Family Fun Day, which took place in Dublin Zoo with over 140 people enjoying the day out. It was also great to get back to an in-person annual conference, which was held as a hybrid event. Other events included 122 workshops, seminars, and information sessions on specific topics, and 119 epilepsy awareness sessions given to schools, preschools, and other educational settings. Core elements of our service continued in 2022, including the Living Well with Epilepsy programme, which is aimed at those experiencing a newly diagnosis of epilepsy. The STEPS self-management programme, our support of the advanced nurse practitioner role, specialising in supporting women with epilepsy, and our Training for Success, our TFS programme at the ATU Sligo. TFS has been a hugely successful one-year QQI Level 5 programme based in Sligo, which has supported hundreds of young adults with epilepsy since 1998. However, with the development of ATU Sligo, changes to the training landscape and reduced demand for TFS in recent years combined to threaten its continuation for the 2023 term. While this year did go ahead, the future of the course is uncertain. Alongside these and other long-standing services, we don't want to stand still, and we were delighted to bring forward several new initiatives in the first year of our strategic plan. These include our mid-morning mindfulness sessions and our Get Charty programme. Epilepsy can be a stressful condition for many, and the offering of weekly online mindfulness sessions throughout 2022 proved to be extremely popular and successful, with over 500 people taking part, including myself. The Get Charity project was especially aimed at children and young teens with epilepsy. It can be difficult for this age group to meet others living with the condition. So this project brought groups together to meet with others informally and do some art at the same time. It proved to be extremely popular, with almost 100 children taking part across the year. And we look forward to developing our support and education services in the years ahead. Our second strategic aim was centering people with epilepsy and their families in the work of Epilepsy Ireland. To recognise that people with epilepsy and the lived experience of epilepsy remains at the heart of all we do, this was added as a core organisational aim in our new strategic plan. This ensures that the board, management and staff are mindful at all times of the importance of understanding the needs of the epilepsy community and planning our work accordingly, with a stronger emphasis on engagement and a greater role for volunteering. So much of what we do depends on the support and input of our members, service users and volunteers. This includes taking part in awareness campaigns, supporting fundraising and providing feedback consultation on our plans and activities. In 2022, we consulted with our members and service users on a range of projects and activities, including the planning and execution of International Epilepsy Day and the themes of our annual conference. Regional service plans are also developed annually, taking feedback from local service users into consideration, while the priorities of our most recent research call, completed in 2022, were also set by members and service users. There is scope for us to improve in this area, and we will shortly be establishing a new service user consultation group to further this objective. I want to thank each and every one of our volunteers for your support throughout 2022, and we hope you continue to be there with us in the journey ahead. I want to give a special mention to our 2022 Volunteer of the Year, which was posthumously awarded to Louise Young, a young woman who passed away due to SUDEP in 2021. Louise had been an active volunteer, and her family and friends have continued her work with great commitment since her untimely passing. The award was a very small token of our appreciation for the great fundraising and awareness work that has been undertaken. Our third strategic aim is working collaboratively to improve the care of people with epilepsy and knowledge of the condition. Epilepsy Ireland works collaboratively with many different stakeholders, including state bodies, healthcare and educational professionals, and the medical scientific community, to improve the care of people with epilepsy and to increase knowledge of the condition. There are many aspects to this, which you can read about in our annual report, but I'm just going to give you a focus on a few of them in my report this evening. The first one is our training program on epilepsy awareness and administration of buccal-midazolam. This is a training program for professionals, including care staff, teachers, SNAs, and other health professionals, which has been a fixture of our service since 2009. Participants develop a greater understanding of epilepsy, learn about the role of the emergency rescue medication, and receive instruction in the correct administration of midazolam. In 2022, 2,536 professionals took part in this important training through 236 training sessions. We also engaged with several third-level institutions to deliver epilepsy awareness training to medical, bioscientists, OT and nursing students in UCD, RCSI, UL, UCC, Waterford and Athlone. Secondly, understanding more about epilepsy is vital to improving our overall knowledge of the condition. Since 2010, Epilepsy Ireland has played an active role in directly investing in Irish epilepsy research, and I'm pleased to report that 2022 was one of our most successful years in this regard, with a record number of 5 new projects funded. These included projects focused on rare epilepsies, Dravet syndrome and CDKL5, the role of epilepsy seizure detection devices, the information needs of women with epilepsy, and the search for biomarkers in both autoimmune epilepsies and temporal lobe epilepsy. These new investments take our total investment, including future commitments, to over 1.5 million. This is something that we are very proud of, and as our research is funded by our donors, volunteers and supporters, I am sure that you are too. Thank you to everyone for investing in the search for knowledge and better outcomes and treatments for us all. Other collaborations that further objectives include those with the HSE, the Irish Epilepsy League, the International League for Epilepsy, the International League Against Epilepsy, the Neurological Alliance of Ireland, the Disability Federation of Ireland, UK charity SUDEP Action, and the Infantile Spasms Awareness Network. We look forward to continuing our work with all these stakeholders. Our fourth strategic aim is transforming perceptions of epilepsy and public policy relevant to the condition. Epilepsy Ireland takes part in or leads campaigns aimed at raising awareness of the condition in Ireland. These include National Epilepsy Week, SUDEP Action Day, Infantile Spasms Awareness Week, Brain Awareness Week, and many more. Our flagship awareness day is International Epilepsy Day, which takes place on the second Monday of February every year. For the 2022 campaign, with the help of our incredible volunteers Lisa, Wayne and Lucy, we developed an eye-catching campaign looking at how the general public can respond to epilepsy and seizures incorrectly, while reiterating our key message of time, safe stay when providing seizure first aid. The campaign was a huge success with several key media placements and a huge social media reach with over 2.5 million impressions. We've also invested in our advocacy work in recent years, and this is beginning to pay real dividends. In 2022, there were several highlights that have potential to positively impact on the lives of people with epilepsy and their families. Our work with the Department of Social Protection on our long-standing campaign around access to free travel led to the commitment by the Minister to prepare a report on how the issue might be addressed. We're currently awaiting the publication of this report. Another long-standing issue concerns our campaign on sodium valproate, and major developments were secured in 2022, including on the terms of reference for an inquiry into the drug's historical licensing and prescribing, the establishment of a stakeholder group to assess and improve current risk reduction measures, and the confirmation of funding to recruit new epilepsy nurse specialists to better implement the pregnancy prevention programme. Progress has also made on securing access to deferred Leaving Cert exams for students who have a seizure before their exam, something I'm delighted to report was extended this year to seizures that occur during exams. Other activities during the year included working with the Neurological Alliance of Ireland's Patients Deserve Better campaign, which seeks to address the shortfall of neurological specialist nurses, advocacy around draft online safety legislation, and preparing a submission to the NCPE supporting the reimbursement of the new anti-seizure medication cenobamate. Our fifth strategic aim is increasing and diversifying our income. Following 2 very difficult years due to COVID-19, the fundraising environment improved slightly in 2022. Community and volunteer fundraisers were as crucial as ever in controlling our financial challenges. My colleague, Paul Keogh, our treasurer, will discuss our financials shortly, but I want to put on record my thanks to everyone who helped support our work by donating or taking part in a fundraiser for Epilepsy Ireland in 2022. Our 6th strategic aim is demonstrating the highest standards of governance and ensuring the structures are in place to meet the objectives. The Epilepsy Board is committed to the highest standards of governance. This is a key obligation, not only in ensuring we can fulfill our mission at Epilepsy Ireland, but also in maintaining the trust and confidence of members, service users, funders and donors. We maintained the Charities Institute Ireland triple lock standard. This means that we comply with the guidelines for charitable organisations on fundraising from the public, the Charities Regulators Governance Code, and the SORP accounting standard. The board first declared the organisation's full compliance with the CRA Governance Code in 2021, and this was restated in 2022. We also maintained the Improving Quality Foundation quality mark, a quality standard developed specifically for small non-profit organisations. The board met 7 times in 2022, and some of the good governance work undertaken included finalising the 5-year strategic plan, approving the appointment of Mazars as the charity's new external auditors, developing and implementing a 12-month board development plan to ensure we continue to govern the organisation to the highest standards, reviewing and approving updates to over 20 internal policies and procedures, approval and monitoring of operational plans and budgets, conducting a benchmarking and review of staff salaries, strengthening and the functioning of our subcommittees, and monitoring the organisation's medium and long-term financial sustainability, to name but a few. We are very lucky to have a board that is made up of committed, enthusiastic individuals, all who share in the organisation's vision and mission. Our board understands and appreciates the demands of the role and the responsibilities of directors, and I want to thank all our directors for their support. I want to thank Mark Dowdall, Derry Gray, and Shane O'Brien, who have all stepped up the board in recent months. Mark has been a long-serving member of the board, including a term as chairman, notable for his guidance of the organisation through a period of change. Derry brought great rigour, integrity, a business brain to the workings of the board, and a great sense of humour. And Shane brought great energy, financial nous, and common sense approach to the table. We will miss them hugely, but we know they are there to help out if needed, and we wish them all the very best and thank them for their service. Finally, I just want to say how difficult a job it has been to summarise our entire year into somewhere just running over 15 minutes, no doubt. So many things haven't even had a mention, and several parts of our work that took months of planning and execution have been summarised here in just a sentence or two. It is a testament to our staff team that this is the case. It is a relatively small team of just over 20 people, many of whom are part-time. Despite several recruitment challenges in 2022 that reduced our capacity, unfortunately something that's now very common within the voluntary sector, it was a successful and busy year and an excellent start to our new strategic plan. I want to sincerely thank our hardworking CEO, Peter Murphy, and all the hardworking team for their dedication and their work on behalf of us all. Thank you to everyone who has supported the work of Epilepsy Ireland. We are all working to achieve a society where no person's life is limited by epilepsy.